Well, I think healthcare in general hasn't done a particularly good job at integrating the patient voice to date. And so digital technologies actually give patients an opportunity to really be an active participant, to really have a role in being able to actually use technology and use tools that are in their command, in their control, and then bring that information into an opportunity with their clinicians to better understand what's actually happening in their health and healthcare. A good example, we did a project with people with multiple sclerosis using a Fitbit. And for most of us who are healthy, using a Fitbit comes down to counting steps and seeing how many we can sort of achieve and compete with other people with. For people with MS, what they were finding was that it was helping them better understand the threshold that they could reach before becoming too fatigued. And so it was a way of being able to actually modulate their symptoms, but it gave them control over something that they previously would have had to sort of guess at. Well, I can only go so far before I'm going to get really tired. Now they had a good benchmark and they could actually monitor that over time. Well, you know, it's interesting. In the U.S., we passed the 21st Century Cures Act a few years ago, and that actually has very specific language in it that's requiring and mandating various parts of the Health and Human Service agencies to begin using real-world data, to begin using patient experience data. So this has been, I think, a real driver for industry, for device makers, and for others, even regulators, to really try to figure out how do we then start to use this. So I think we have been sort of accelerating the process by virtue of the Cures Act, which I think has been helpful. But I also think that there had been some already early adopters thinking about this kind of evidence in some of the industry and pharmaceutical companies in the last number of years. And so they were beginning to set up real-world evidence divisions and teams, and so I think they were prepared when some of the legislation started to give them an opportunity to actually act on that. As far as other countries, one of the challenges for the U.S. is we have a multi-payer system. When you're in a one-payer system, the data that's coming in about any individual patient is coming into one record for the most part. So I think it's a little bit easier to then bring that data together in a coordinated and collaborative way to paint that holistic picture without having to go through the sort of the data linkages that we're going to have in the U.S. with data coming in from so many different sources. Now, other countries will, even with the one-payer system, will still be challenged with novel device information, data that's coming from devices we haven't traditionally integrated into the healthcare data sets. So those will still be a common experience, but I think globally people are getting more and more excited about the opportunity that digitization of data can offer once we begin to really harness what that data can then turn into in terms of evidence.